Good morning, students. In this video, we are going to talk about the important Viva question on the cervical vertebrae. Now, these diagrams are the illustrations which I am going to use for this video are taken from the Theme Dissector volume 3. The volume 3 Theme Dissector is for head, neck and the brain, and I am the author of this volume, and I am thankful to the Theme publisher for using this diagram. Now, many important questions they are there on the cervical vertebrae. Now, the first question which may be there, how many vertebrae are there? How many vertebrae are there in the cervical vertebral column? Your answer should be that there are 7 cervical vertebrae which are present in the cervical vertebral column. Then the next question will be, okay, how many of these cervical vertebrae they are the typical or the atypical vertebrae? Typical means what? Then you should say that the typical cervical vertebrae, their structure resembles to one another, and that's why they are called as typical, and they are C3, C4, C5 and C6. So, the 4 cervical vertebrae, see the pointer, this is the third cervical vertebrae, fourth, fifth and this is. All these 4 cervical vertebrae from C3 to C6, their structure resembles almost with each other, that is why they are called as typical cervical vertebrae. While the first cervical vertebrae atlas as it is seen here and second cervical vertebrae axis, similarly the 7 cervical vertebrae they are atypical cervical, they are classified as atypical because they have their own structure which do not resemble with any other vertebra in the cervical vertebral column. Once you have just seen the questions which are very common question on the cervical vertebral column, then he may ask if you have given the reply properly, he may ask that there are 7 cervical vertebrae but the spinal cord segments are 8. Then you just tell me which of the spinal nerves are related with this vertebrae, where they are relation. Then tell that since there are 8 spinal segments, there are 8 cervical spinal nerves, and these nerves they come out above the corresponding vertebrae. For example, this C1 will come out from here, C2 from here, and through the intervertebral foramina between C2 and C3, the third cervical nerve will come out. Through these foraminas, the nerves which will come out, they are always above the vertebra, corresponding vertebra. For example, below the C7 cervical vertebra, from the intervertebral foramina between C7 and T1, the cervical nerve which will come out from this point where my pointer is moving will be the C8 cervical spinal nerve, and then the T1 spinal nerve will come out below the thoracic first vertebra. Okay, so in cervical region they come out above the corresponding vertebra, but in thoracic region and then following the lumbar and that of the sacral region they come out below the corresponding vertebra. Okay, then there may be a question, okay, about the typical cervical vertebrae. He may ask you the typical cervical vertebra which are from C3 to C6. You tell me the parts of a typical cervical vertebrae. You tell that a typical cervical vertebra consists of 2 parts, body, where my pointer is moving, that is body, and then the rest of the bones which are seen laterally and posteriorly, they are the part of the neural arch, and neural arch has 2 major component or parts, pedicle, this where pointer is there, this is the pedicle, and then lamina here posteriorly or posterolaterally is lamina, and the pedicle, body and lamina they enclose a foramina what is called as the vertebral foramina, okay, vertebral foramina. So the neural arch component consists of pedicle and lamina, and then he will ask, then what are these bony processes? Then you say that from the neural arch, which consists of the body, which consists of the pedicle and lamina, 7 different bony processes they come out. For example, from pedicle and partly from that of the body, this process which is coming out is called as transverse process. And then, okay, at the junction of pedicle and lamina, the process which are coming out here, two superior on right side and there are two inferior articular process, and from where the two laminae meet, okay, in midline, then the posteriorly the process which comes out is called as spinous process. Then he may ask you, what is the peculiarity of the transverse process of the cervical vertebrae? You say that the cervical vertebrae characteristically has a foramina, and this foramina they are called as the foramina transversarium. Then naturally the question will come, why these foramina are there, what passes through these foraminas? Then you say that through this foramina passes the vertebral artery on right side as well as on left side, along with that of the vertebral vein or plexus of vein which is going to form the vertebral vein. Then he may ask then which is the peculiarity of the spine, and the spine you can say that in a typical cervical vertebra, spine is very short and bifid. Okay, so you are seeing the two spinous bifid process, okay, here. So these are the structure. Then he may ask another question, what are the tubercles of the transverse process and how many they are? You can say that there is an anterior tubercle and then there is a posterior tubercle of the transverse process. In this way, this many questions can be there on the typical cervical vertebrae. Then question naturally will come on the atypical cervical vertebrae. Now he may ask you which vertebra is this, okay, and when you will pick up this vertebra which is called as atlas vertebra or C1 vertebra, then he will ask you, okay, how it differs from a typical cervical vertebrae. You say that there is no body, though in the rest of the cervical vertebrae there is a body is present, but in C1 or atlas vertebra there is no body, and this is a ring shaped structure, and there are two lateral masses, and on the superior surface of this lateral masses there is a concave articular facet, and this concavity is facing upward. And then to these two lateral masses, this is the anterior tubercle on the anterior arch. Similarly, he can ask you where is the posterior arch. So you can say that posteriorly these two lateral masses, they are interconnected with each other by the posterior arch. There is a tubercle in the posterior arch or posterior tubercle, and then there is an anterior tubercle on the anterior arch. Then he may ask you how the transverse process are different from that of the other cervical vertebra. You say that though there is a foramina transversarium which is the characteristic feature of a cervical vertebra, but here the anterior tubercle and posterior tubercle of transverse process are not present. Only there is a single tubercle on the lateral most aspect or the end of the transverse process, okay. So these are the structures which he may ask about the atlas vertebra. And another important question can be that why it is called as the atlas vertebra. You can say that because it articulates with that of the condyles of the skull, okay, and it carries all the weight of the skull. That's why it is called as atlas vertebra. According to Greek mythology, the Atlas who carries the weight of the earth. Similarly, this vertebra is responsible to carry the weight of the head, which resembles to an earth-like rounded structure. Okay, there is a groove here. Then he can ask you groove. Why this groove is there, and what are the structure which lie in this groove just posterior to the lateral mass. Then this groove where pointer is moving, you can say that there is the presence of the artery. What is the vertebral? Fourth part of the vertebral artery is lying here, and this is accompanied by also the C1 nerve. Okay, so this is the vertebral artery and the cervical one nerve, they lie in this groove. Okay, now he can ask you that how many joints are there in this vertebra. You can say that on the superior surface it forms the joint atlanto-occipital joint with the occipital condyle of the skull, and on the anterior arch posterior aspect this is the joint, and this is will form a joint between the dens or the odontoid process with the anterior arch. Okay, anterior arch will be there. Then he will may ask you some of the other atypical vertebra. Now this is C2 vertebra, which is also called as axis, and the question will be there, why it is axis? How you have identified that this is the C2 vertebra? You say that it has a peculiar structure because there is a tooth-like projection is coming out, okay, from the superior surface of this vertebra, and that is the called as dens or odontoid process. Then he will ask what are the two facets which are seen. You say that it is the superior articular facet which forms the atlantoaxial joint with the two inferior articular facet of the atlas vertebra. Again, then he will say that what are the structure on its inferior surface. You can say that on inferior surface there is a body and then the two inferior articular facet. Then he can ask you, okay, which is the thickest lamina among all the cervical vertebrae. You say that the thickest lamina is that of the C2 vertebra, and the spine is not bifid as such, and it is mostly quadrilateral and strong, or just the beginning of the bifurcation can be seen into that of the spine of the C2 vertebra. Okay, C2 vertebra. Then there may be a question on to that of the C7 vertebrae. If we go to the C7 vertebrae, you can identify it with the presence of a single long spinous process. Single, I mean to say, there is no bifid. Okay, there the tip of the spine is not bifid, but it is showing a single rounded tubercle, and it is quite long. That's why sometimes this vertebra is called as vertebra prominens. Then he may ask you about foramina transversarium. He may ask an important question, what passes through this foramina transversarium of C7? You say that it is vertebral artery is not passing. Please remember that vertebral artery is not passing through the foramina transversarium of the C7. It is only the vein which passes. So sometimes this foramina in the C7 are very narrow foraminas are there, or they may be divided into two parts. Okay, then he may ask you, that means what is the situation, I mean to say, what is the structure of the transverse process? You can say that anterior tubercle of the transverse process is almost rudimentary, but the posterior tubercle is projecting. Okay, then he may ask you what is the shape, how the shape of the body differs from the rest of the cervical vertebrae. You can say that the shape of body is more towards the shape of the thoracic vertebrae, which is probably the heart shaped vertebrae. Now this will be complete the Viva on to the typical and atypical cervical vertebrae. Thank you very much for watching this video.